So for this task, we are doing a vaginal smear and cytology on our patient Coda. So we have all of our supplies, got sterile cotton swabs and our saline. So what we're going to do is get a good sample and then place it onto our slide. Then we'll stain it and look at it under the microscope. So everything all set. So while we get Coda into position, come here. Get over here. And then we moisten the tip with some saline. Come here. Coda's not enthused about this. Okay. So the owner restraining. I'm sorry, sweetheart. I know. I'm so sorry. You're okay. We're just going to make sure we roll the swab so that we're getting an appropriate sample, but you want to do it very gently so as not to cause any harm to the patient. And then we will make sure we roll that onto our slide so that we can get a good idea under the microscope of the different cells that we see. So we'll dry that, and then we'll be using our Dip Quick. We use the clean ones, not the dirty ones that we use for your cytologies. And we want to dip it 10 times in each one for 1 second each. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 4, 5, 6, 7, 8, 9, 10. And then we will carefully just rinse the excess off. And it will dry, and we're ready to look at it under the microscope. Okay, so now we're ready to look at our canine vaginal smear under the microscope. We're going to assess the slide like we would assess any other, which is in a zigzag pattern. We want to start at the top, the corner of the sample, go all the way across, making sure that we're looking at every field, and then go down a field, go back the other way, and then keep repeating. That way we are making sure that we're not missing anything. So we're going to start on our low power field. From here, just kind of see a bit of debris. Not a ton of other stuff, which is to be expected because this is a kind of middle-aged spayed female. So we would be seeing different cells if she were an intact female and she were in different parts of her estrus cycle. But what we can kind of expect to see are parabasal cells for this sample, maybe some yeast, maybe some bacteria. But as far as cells for the estrus cycle, because she is no longer in estrus, we won't expect to be seeing too many different kinds. So from here, we'll go to higher power, take another look, and we're still just seeing some debris. We won't really see any of our cells until we get to our higher power. So from there we'll switch to 40. Again, you know, we can kind of see colors first, and then we can start making out some shapes, and then once we get into our higher power, then we can start differentiating our cells. So we'll move to our higher power now. Just a little bit. Okay, so it's on this that we can begin to see our individual cells
And as suspected, we're mostly seeing parabasal cells. Our parabasal cells have kind of that large nucleus, the round, rough edges, it's what you would expect to see for a dog that's in an estrus. Sometimes you might be able to see some intermediate cells, which have a smaller nucleus, and intermediate cells can be present in any stage except for estrus, but it's more likely that what we're seeing are parabasal cells. No bacteria that I can see so far, but just a little bit of yeast. And so, as always, we'll have our DVM take a look at this after. A little bit of debris, some epithelial cells, all of which is fairly normal.
Okay, so once we've examined the entire slide, we will write down all of our observations. If there's anything abnormal, we'll have someone else double check, and then we'll be all set. Okay, so now we will take a look at some of the cells that we would see during different phases of the canine heat cycle. So we've got our superficial cells. We see that during estrus, or while the female is in heat. They've got the smaller nucleus there, kind of the round, jagged edges, and you'll see that while the dog is in heat. We also have the intermediate cells. These are actually present in all stages besides estrus, so you can see them pretty often when the dog is not yet technically in heat. Their nucleus is a little bit bigger, and still the kind of jagged round shape for the intermediate cells. Then we also have the parabasal cells. This one you can recognize because of its large nucleus. And the parabasal cells are present in an estrus, and then also sometimes in diestrus, so when the estrus cycle is ending and when the dog is no longer in heat, or also in dogs that have been spayed and have no hormonal activity. So we'll take a look at our different stages and the cells for each of them. So this is an example of a cytology of a dog that's in proestrus. So you can see those intermediate cells. They almost kind of look like the parabasal cells, except that the nucleus is smaller. So those will be present in proestrus as the dog is kind of preparing to go into its heat cycle. You can take a closer look at those intermediate cells. You can also take a look at our cells in our estrus phase of our cycle. This is when the dog is in heat, and you can really see these superficial cells well here, the kind of tiny, just barely there nucleus. You can see that the dog is in the middle of its estrus phase of its cycle. You can then take a look at when a dog is in diestrus, which is when it's no longer in estrus, but kind of the middle time between estrus and anestrus. This is when you'll see a decrease in the superficial cells that were present during estrus, and you'll start to see some intermediate cells, and our parabasal cells will start appearing during this phase. So you can see here lots of intermediate cells. So intermediate cells, but then you also have parabasal cells there as well. Both can be present during this stage. And then finally,
we have an estrus, which is when the dog is not having any kind of hormonal activity. So most of our spayed dogs, we see mostly spayed dogs, and so this is what most of our cytologies would look like. Also can be seen in dogs that are in an estrus and not spayed, but just not during the pro-estrus, estrus, or diestrus phase of their cycle. And these, you'll see the parabasal cells, and then you can sometimes still see some intermediate cells on these cytologies as well. And that is our 4 stages of the canine estrus cycle and the cells that you can expect to see in each of those stages.